FGFR targeting in cholangiocarcinoma, I think, is a very interesting and rapidly evolving field. One of the first studies showing efficacy of FGFR inhibitors in BTC was the FIGHT-202 study. And based on this single-arm study, we have received an approval for Pemigatinib by FDA and EMA, and I think it's now used in the clinic. Then this field really rapidly evolved further, and we have first Futibatinib was introduced. The study has now also been published as a full publication in the New England Journal of Medicine by our US colleagues. In this study, we already observed a slightly higher efficacy. It's an irreversible FGFR inhibitor. However, median overall survival was not, it was a trend for a longer median overall survival, but not significantly hard to compare because it was two different single-arm studies. And now actually, the study is, the field is further evolving. We have now new drugs like, for example, Relife 4008, which is a very specific FGFR inhibitor, which does not mean it's more active compared to the other inhibitors, but it's specific for FGFR2 and not the other FGFR receptors. And with that, we have less, if you like, off-target efficacy, toxicity, such as, for example, hyperphosphatemia, which is related to FGFR1, or diarrhea, which is more related to FGFR4. And with this highly specific FGFR inhibitors, we have seen really amazing response rate. We have to acknowledge that it's only a phase 1b study. So we have to wait for more mature data, specifically progression-free survival, overall survival. But response rate was really over 70%, and we had a disease control rate of 100%. So this looks really amazing. However, we need to see whether this really translates in a longer PFS and overall survival. So it's still early, but I think the presentation at last year ESMO and this year ASCO really highlight that the field is further evolving at the moment.